Okay, so this is a comprehensive history on Brandy for her very first visit, and whenever we bring a patient back here, we say, you know, I just say, hi, I'm Greg Johnson. I don't have to say doctor, because by the time I'm done with them, they know I'm a doctor.
Right.
And so I don't introduce myself as doctor. I just say, I'm Greg Johnson. Happy to meet you. Welcome to our
Hi,
office.
nice to meet you.
So Brandy, if you had a laundry list of all your complaints, beginning with what you feel to be your primary complaint, not what other doctors have told you, but what you feel to be your primary complaint, what would that be?
My primary complaint is burning right here.
In your
on
neck
the-
and upper back?
Not like
Your upper
on
thoracic
the
more?
shoulder.
On the left shoulder blade area?
Yeah.
So we're gonna put that as T-spine pain, and that translates directly into ICD-10 code. And I'll put upper thoracic just to define it more on my chart notes. And if you had to rate that on a 0 to 10 pain scale as we're sitting here right now,
Right now,
Where would
it's
you
like
put
a
it?
4,
and the worst ever, 10 means you're in the hospital getting morphine, obviously it's so bad.
6.
Okay. What's your number 2 issue?
Number 2 is I have tingling and burning fire going to this part
Okay.
of my head.
And
from
your
my
neck as well?
To here. Yeah.
Okay.
I can see
Does
the,
it radiate out to your arm or hand ever?
no, like straight down to the
To the shoulder blade? Okay.
But it even hurts like just to touch it like this.
Okay. So I'm putting that down as neck pain, stiffness, cervical segmental dysfunction, ICD-10 code. And if you had to rate that on a 0 to 10 scale as we're sitting here, where would you put that at?
It's probably a 4 right now.
Okay. And the worst ever?
7
Okay. Do you ever get headaches, Brandy?
sometimes.
Well, sometimes, once a year, twice a year, twice a month, once a month? Once
Twice a week.
Twice a week. That would be considered frequent, by the way. 1 to 2 per year is considered within normal limits. So if you're having more than 1 to 2 a year, there's an underlying cause. So I'm put that down as tension, headaches. I know you said migraine, but it's probably not a real
it's
migraine.
not a migraine. It's just little headaches.
Okay. And 2 times a week, I always write frequency down, and then I get occipital temporal for her. Do you have a headache right this moment?
No.
Okay. What's the worst headache you've ever had? 0 to 10. And I get 2 sets of numbers on this first one too. What it is right at the moment that they're here, and then was it been the worst ever in their lives? Yeah.
5.
Okay.
Not.
Do you ever get dizzy?
Yes.
How frequently does that happen?
Once a week?
Okay. Do you feel dizzy today?
No, sir.
And what's the worst dizzy spell you ever had? 10 means you're so dizzy you're actually falling over to the ground.
Oh, no. 3.
Okay. You ever lose your balance? You ever like tilt over and lose your balance or fall?
Sometimes.
Yeah.
Just when I stand up from.
Giving from lying down to standing position.
Right. If
or
I do
sitting
it quickly,
standing
I might
position?
just catch
So it's
myself.
positional mostly.
Yeah.
Okay.
Yeah.
Okay. You're not just getting that sitting around or
No.
standing around.
Mm-mm.
Okay. How about your mid back? You're feeling around your bra strap area?
That's fine, except
Okay.
for,
Getting some sternal pain?
yeah, like right at the
Right down the bottom of your
it
sternum?
pops.
Okay. So I'm putting that down as costosternal segmental dysfunction, which is subluxation, and there's an ICD code for that too. Do you have any pain right there today, Brandy?
Yes.
What number would that be rated at right now, as
2.
we're sitting here? And the worst ever on that one?
2.
Okay. Do you ever get acid reflux
Not
or
normally.
heartburn?
Rarely.
You ever had any pain around your rib cage on either side? I know that's up into your sternum there. That's the ribs too, but that's the only thing on the sides.
No.
Okay. How about lower back?
Not normally. No.
You don't ever get lower back pain?
Mm-mm. Not-
Really?
Not.
That's 80% of the entire population of the
When
world
I
gets low
was
back pain.
pregnant, I had lower back pain.
How long ago was that?
Oh God.
You're not that old.
14 years ago. But no, not typically.
Okay. Have you ever had leg pain or butt pain with that when you had low back pain in the past when you're pregnant?
Yes.
Which side?
I don't remember.
Okay. So you don't feel any of that today at all?
Nope.
And what's the worst that did get when you were pregnant?
2.
Okay. Wow, not bad at all. Most pregnant ladies would be going 8 or 9 on that. Yeah. Have you ever had numbness or tingling in your legs or your feet or your arms or your hands?
Yes. after my first epidural, this leg was numb for 6 months.
Mm-hmm. Okay. On the outside here, or the
No,
calf,
this
or
part.
your thigh mostly?
Mm-hmm.
Okay, that's L3.
Like I couldn't feel this.
Okay. On the right side only?
Mm-hmm.
Okay, so is it numb today at all?
Nope.
And the worst that ever got when you did have that? 10 means I could stick you with a sharp saw and you don't even feel it.
Oh, probably an 8.
Okay, up there then. When was that epidural?
That was
What year?
15 years ago, 2005.
205? Pregnancy. Was it a normal vaginal delivery or was it
Yes, sir.
C-section?
Normal.
Okay. You just had the one chop?
Two.
Two? How'd the second one go?
Good.
No ease,
No.
epidural in that one?
I had epidural, no problems.
Okay. And what year was that?
2007.
Okay. And no complications from that one at all?
No.
Okay. Any accidents or traumas in your history, Randy? Car wrecks, motorcycle wrecks, mom dropped you on your head?
No.
Not that she told you about it, yeah. Okay, any other issues, shoulders, elbows, wrists, hips, knees, ankles, anything going on in your extremity joints? Your right thumb?
Yep. This right here.
What are you feeling there?
Just hurts.
Whereabouts does it hurt?
Here.
Right in that joint?
Here.
In that joint? Okay. Have you injured that before? Where you jammed it in?
Well, kind of fell down the stairs the other day.
Kinda, huh?
Yeah. and
How'd that
so-
work?
Yeah.
Kinda.
It was a tumble down the
Okay,
stairs.
did you feel it tweak when you did that? Did you feel the pain in there?
No, it was
Is it afterwards?
Yeah.
Okay. So I'd put that as just right thumb pain, distal and proximal, cause it's proximal and distal joints. You have pain in your thumbs right now, as we're sitting here?
Mm-hmm.
What number would you put that at right now?
1.
And the worst ever?
3.
Okay, and that was when again?
That was a few weeks ago. 3 weeks.
Did you have any other aches or pains from your fall?
I had a little knot on my head.
So you hit your head?
Yes.
Were you knocked unconscious?
No.
Okay, did you get dizzy or see lights or anything afterwards?
No.
Okay. Do you have a headache afterwards?
No. I don't
Neck
have
pain
that.
afterwards?
No.
Okay. So it's fairly mild trauma to you. You must have a hard head.
I do. That I do.
Okay. Have you been diagnosed with any medical diagnoses, brain in the past, heart attack, stroke, cancer, diabetes, high blood pressure, anything?
High blood pressure.
Yeah, your BP's high here today, it's 150 over 104, so I would suggest that you get that monitored anyway.
Yeah, I
from
just
your
started
primary
new
care.
blood pressure medicine, but I don't think
What
it's
are you
high
taking?
enough. Low sartan,
Losartan, what milligram?
25.
Once a day?
Yes, sir.
Any other meds?
Nope.
Okay. When was that diagnosed? What year?
This year.
Okay. The year of the COVID,
Yep.
you get high blood pressure, huh? Imagine that.
Yeah.
When's the last time you saw your primary care physician for that?
I started about 2 months ago.
Does he know it's still this high even after taking the losartan?
No, because we actually started on lisinopril.
Right. That's the most common one.
And I only have 1 kidney.
Oh, okay.
So we started on lisinopril, but I started coughing like crazy. So I
Got
asked her
off
to
that one.
switch it.
Okay.
So it was regulated on lisinopril, so I think the losartan's just not high enough.
Okay. Have you been hospitalized for anything or had any other surgeries other than childbirth?
Oh yeah, I did. I had like inflammation of the intestines, acute.
Colitis? They call it colitis or?
It was something like that, yeah.
That's
Of
inflammation of the
the
colon.
upper colon.
Oh, the upper, so it's probably ileitis then. Ileitis is your ileum, that's the small
Mhm.
intestine. Colitis is more
No,
your
it was-
colon,
it
that's the
was the
large
colon.
intestine. It was your colon then?
Mhm.
So it's probably colitis. or colonitis.
I don't know. It was acute.
It's
lasted a
inflammation
few
of the
days.
colon, basically what that means. And when was that?
A couple of years ago.
So 2018 sound about right?
Yeah.
Did you receive any treatment for that?
Yeah, I was in the hospital for a few days.
What'd they do?
Antibiotics.
Okay, so no surgery though?
No, vaginal
Okay.
Cipro.
Okay.
That's it.
IV antibiotics?
Mm-hmm.
Okay. Cipro's pretty high dose antibiotic too.
Mm-hmm.
It's a broad spectrum. Any other history of hospitalizations or surgeries or anything?
No.
Okay. When's the last time you got an adjustment? I assume you get adjusted.
A week ago.
Okay. For these same issues?
Yes.
And did it help you?
Yes.
So let's write down, last DC adjustment 1 week ago. And then I put helped, if it helped, and if it didn't help, I put no help. So it just gives me an idea of what their previous experience has been, that's all. Is there any other history you'd like to share with me, Brandy, before I move on with my orthopedic neurological exam on you?
No.
Anything that we haven't discussed that you'd like to share with me? Okay. So what I'm gonna do next is called an orthopedic neurological examination. I'm just gonna check your spine, your pelvis out myself and see what's going on, and then we'll go from there.
Okay.
Okay? So if you feel a tweak or a twinge of pain on any of these tests, you let me know, okay?
Okay.
I'll probably know ahead of time, but you can tell me anyway. The first thing I'm gonna do then is, Brandy, I'm gonna compress your spine. Does that cause any increased pain or tightness anywhere?
Not in my back. It just
In your head right there?
Is that tingling
That feels
fire
more.
stuff right there.
Have you checked her sutures out here? She's got some structural issues here with her temporal lobe. So you can feel that little knot right there?
That's where you hit your
Well,
head
I
and
also
fall,
hit
right?
my head. That's where I hit my head. But the burning fire stuff
Well, see,
was
watch those.
happening
See, this is
before
the
that.
suture. Do you feel that all the way around there where my finger's going? You feel that little indentation there?
Yeah.
That's your temporal suture. And it goes all the way around. There's the knot right there.
Right,
Yeah.
that's
Okay, so now I'm gonna go backwards in this way. Down, does that cause any pain or stiffness anywhere?
no.
Okay, so now we're gonna go back and left and down. How about that one?
No.
No neck pain or back pain anywhere?
Mm,
Okay, if you tilt your right ear to your right shoulder, does this tighten up?
no.
This way?
No.
So if they have negative pain on range of motion, I don't even do the shoulder depressor because it's gonna be negative anyway. So I'm gonna lift straight up on your skull. Now, Randy, does that cause any relief of pain or cause it to get worse or stay the same?
It's better.
Okay.
Uh,
Now I'm gonna push down, I'd like for you to resist. Good, boy, you're playing strong. There you go. You better watch out for this one. She's
Just
down.
me.
Okay, let this go. Yep. See, with this one, it's easier to get the reflexes, so I don't have to change the positions that much. I pretty much stay in the same position, see? Just hit all three of them. Right there, I don't do the brachioradialis one so much. I do the brachioradialis, I just don't do the distal portion of it down here.
For her, I've been working on her atlas, I've worked on her C2. I just said, hey, suboccipital neuralgia. And I wasn't sure what else to call
Mhm.
what was going on right there,
Certainly could be, yeah.
you know?
It's definitely a cervical genic issue, I think, though. Okay, so stand up right here for me and face the mirror now. Brandy, I'm gonna have you close your eyes and then bend your head forward all the way, and then backward all the way, and then back to neutral with your eyes closed. Take a deep breath in, relax it out. So when you close the eyes, the reason I have the patient close their eyes, it takes out their visual three-dimensional space orientation, so you're getting a true biomechanical analysis of
See
their
what the cerebellum
true
has to
posture.
say.
That's right. That's exactly right. I like you get it. That's good. A lot of people don't get that. I'm checking brain stuff out as much as I am everything on this. Because when you close your eyes, it takes out your visual space orientation with your optic nerve. Pelvis is shifted a little bit left, but it's also higher on the right side. You sit in your chair sidewalk, it's like I saw you doing today a lot.
mm-hmm.
It's all right. You knock them out, I'll line them up. All right, Brandy, you can open your eyes and let me show you. You just got a little bit of forward head posture, but you're not as bad as a lot of people we saw today. Yours is here. That's not even over your clavicle yet, but it should be back here. See, your hands are still out in front of you a little bit too,
Mhm.
and that's why, because your shoulders are rounded forward a little bit. Okay, so next thing we're gonna do is have you lie on your stomach, face down in here. And this is the exact sequence that I do in my history and exam, so once you get into this kind of this pattern, it's just easy to knock it out. Her legs are even, by the way, Brandy, good job.
Okay.
That tighten up in your lower back at all, wanna do that?
Just a little bit.
Right, the base?
Here.
Okay, like right there at the end?
Mhm.
Okay, did it tighten up in your thighs at all?
Not really.
Okay, a little bit right there on the left SI. A little bit there too. She had a negative Deerfield and a negative Nautilus though. She didn't have a short leg. She just had a little bit of positive Nautilus, but I wouldn't even determine that as a positive Nautilus because it didn't tighten up. But this right side's tighter. Do you feel that?
Mhm.
All the way up into here. A little bit right there as well. I like these scrubs. Make sure you get the name of these scrubs, Renee. The material looks good. Yeah, give that to her though, because I won't remember it. Is it right there? In there?
Yeah.
And right there is where you're probably getting that pain from your neck up into your head. And she's got a left occiput, an atlas. Is that what you meant, Justin?
Right, I've worked on it before, and I
Okay.
just kind of pick and choose which one I'd take in a given day.
Well, now you can do them both. Get it all.
Hit 'em.
So you do have subluxations in your sacroiliac joints in your pelvis, your lumbar spine, thoracic spine, rib cage, and a few up here in your cervical spine, Brandy, so I can adjust you today for the first time if you'd like to receive your first adjustment.
Yes, sir.
Okay, so I'm gonna start off on this table, since it's your first adjustment. I'm gonna get your right SI first. Brad, can you hand me a vanilla Coke with my throat's dry now? Oh, we forgot. Oh, we did the video though, huh? There. All right, good. I'm gonna bring your legs up again. Brandy, tell me if this one tightens up as much as that last one did.
It's barely.
You still feel it tightening up here?
Yeah, a little bit on the left.
Okay. And if they tell me that, I'll go back and hit it again. Tell me about this one.
No, that's good.
Is it easier?
Yep.
Okay, good. And by the third time, if I do that, and they still say they got it, I don't hit it again. But usually, 2 or 3 is not gonna hurt anything. Let's turn you back now. That wasn't too bad so far, was it?
Nope.
Okay. You're in the middle of the table. There you go. A little bit warm too. They need to have this heat turned down tomorrow. Should I get the AC joints just straight X, the clavicles straight X away from the sternum, and then straight X axis on the anterior ribs here as well. My attorney was getting on me at first when I started doing this. You gotta quit touching these ladies' tits all the time. I said that's not their tits, that's their ribs. Well, this is an educational video for them. I said I'm not doing tit adjustments. She goes, well, that's what it looks like.
Keeping it real.
Yeah, she goes, you're my best and worst client. You're my best one because you do such a thorough job, but you're the one that gets in trouble all the time too, so I like that too. Yeah, she went up there to those Texas board hearings with me
Okay.
when those other chiropractors turned me in for hurting people just from watching a video. Had no idea. The patient wrote me a 5-star Google review and wrote it on their paper. I had chart notes to 0 pain when they left. Okay, let's come around this table next.
We have a TCA chiropractor coming in tomorrow.
Yeah, one of the board directors actually. Okay, so we're gonna start the video over
Okay.
from neutral. We're gonna start this one and we're gonna upload this one to YouTube on our first ring dinger though.
Okay, so we're done
So-
with this one?
Yeah, that's my normal history and examination routine. I do that on every single new patient, every single time. As long as you're documenting that in your charts, you're gonna be fine. And plus, it gives you some clinical
Absolutely. That's
use to
great.
go towards.
That's great.
Okay.
Do you have any questions? Randy? Okay.